So for those of you who don't know me, my name's Christina Hildebrand. I am the president and founder of A Voice for Choice Advocacy. Our mission is to educate and advocate for informed choice and transparency of what goes into your body, be it food, air, water, pharmaceuticals. We want you to know what's in it, and you get to choose whether you put that in your body or not. I am going to answer as many questions as people have in the next 2 hours. Before we get started, I did want to address, I have had a number of emails and a number of even phone calls asking me about the amendments to SB 866 and why A Voice for Choice Advocacy is asking for amendments, and other organizations have basically called us out. I usually don't get into the petty fighting in our movement. Those of you who know me, I've been doing this since 2015 when I got involved and created A Voice for Choice Advocacy. And one of the things that our organization prides itself on is just putting our nose to the grindstone and getting work done. Much of the work, even if you follow us, much of the work that we do, nobody knows about because I don't go out there to brag about our achievements, and I probably should do more. And I know our fundraising director would like me to more, but that's not who I am. That's not who our organization is. We do a lot of stuff behind the scenes. We do a lot of work where we, go down rabbit holes and determine whether it's even a viable path or not. That's who we are. I am doing this today because Freedom Angels, Denise Aguilar, has called me and A Voice for Choice Advocacy out, and her organization, Tara Thornton, and her are working with some of the other organizations in our movement. And I just want to address, her what she's been saying is that, if SB 866 passes, that it is all our fault, all a couple of other organizations that we work with that have requested amendments on that bill. To be very clear, I wish we had that much power. I wish that our organization could say, we want amendments, and authors of bills put amendments in their bill. Unfortunately, we don't have that much power. Senator Wiener with SB 866, Senator Wiener has a bill that has passed without any amendments to this point on the assembly floor, other than the amendment he made on the assembly floor. That is unheard of for a bill. If you go and look at any other bill that has gone through the legislature, it gets amended along the way. That's just how legislation works. That's how bills in California work. They go through and get amendments, usually in every committee. So if anything, this bill is abnormal in the sense that it does not have any amendments, or didn't have any amendments as it hit the second House floor. So let's just be clear on amendments. The amendments A Voice for Choice Advocacy requested, we requested them in January. When this bill first came out, within 2 days, we had written a letter with all the amendments that we wanted. I encourage you to read our amendments because they aren't 15 years old, and they didn't get that from us. They are very, very extensive amendments. We use amendments because we have worked with legislators in previous years, and we've gotten amendments that make a bill, that water a bill down so much, or make a bill okay. And I get people will say, well, there's nothing okay about SB 866. But if you actually read our amendments, we want parents to be informed beforehand. We want parents to be informed afterwards. A lot of things that if we actually got all of those amendments, you would realize that the bill doesn't change legislation that much. We use amendments so that we can have conversations with legislators, and that we're in control of the narrative and the language that's being used. So let's be very clear. Senator Wiener has a bill. It wasn't going to pass the assembly floor, written as 12 years old and up. If you are a legislator and you're in June and you've got 2.5 months left of the session, and you have a bill that is not moving forward, that you're extremely passionate about, and it's the last bill of its kind out of a package that was supposed to be passed this year, put yourself in his shoes. Would you let it die, or would you amend it so that it passes? I can guarantee you would amend it so that it passes. And so this first set of amendments, if you look at the name of the amendments that changed the age from 12 to 15, was called Set 1. There isn't not a Set 1 if there isn't a Set 2 or 3. So he has more amendments in place that he could use to work out and get people to vote for his bill. That has nothing to do with us. He rejected our amendments flat out. We've had conversations with his office. He said, nope, we're not taking any of your amendments. So these amendments that he has and that he's going to bring forward, they may be based off our amendments because we have gone to legislators and had those conversations. But we are very clear that we need every one of our amendments to be put in place in order for us to not oppose and not ask legislators to oppose. One of the key things so that's the history of 866 and sort of that piece of it. I just wanted to respond because I don't appreciate Denise, calling me out, calling our organization and other organizations out and blaming us if SB 866 passes. If SB 866 passes, it's because Senator Wiener did his horse trading and got the bill to pass. The other thing that I want to say about organizations in our movement. So A Voice for Choice Advocacy is the longest standing organization in this movement that was created in 2015 out of SB 277. There are two other organizations that were around before that fought and stood up to the vaccine bills. One was the National Vaccine Information Center, NVIC, which is Barbara Loe Fisher's organization, and the other is Educate Advocate, which is a special needs organization. Those two organizations were in existence prior. But other than that, in 2015, A Voice for Choice Advocacy was created. There were other organizations created at that time. None of them have had the longevity. There are a few that were created between 2015 and 2019. And then there are a number that were created in 2019, and then a number were created in the last 3 years. My key point of that is we were new once upon a time. So I know what it's like being a new organization. But my request for you is do the same thing as you would with any of these bills or anything that you put in your body. It's our mission statement: informed choice and transparency. So look at the organizations that you're supporting and that you're following in the same way. Do your research on them. Are they 501c3s, which means they should just be educating with a little bit of legislation? Are they 501c4s? We have both. We have A Voice for Choice, which is a 501c3, and A Voice for Choice Advocacy, which is a 501c4. 501c4s can hire lobbyists and can do pure lobbying. If they are either of those types of organizations or a PAC, then they have to give all of their financials to the government. You can look at all of our financials. You can see how much we get donated each year, how much we pay for lobbyists, all of that type of stuff. If they are not one of those organizations, then you are giving your money to the individuals, and those individuals can do anything they want with it. They're not accountable to it. So I just want to be very clear that, when you follow these organizations or these people, just make sure you understand where they're coming from and what other organizations they're affiliated to. So, I just an example, the Freedom Angels, they also have another group called Ma Militia. They do civil disobedience, and you can go look them up, but just know what other organizations they're affiliated to. Know what I do. I'm at the same time as I'm telling you to go look at all these other organizations, look at A Voice for Choice Advocacy, work out if we're the organization that you want to follow, work out what the organizations do and what their primary focus is and where their money goes. So I just wanted to share that at the start of this, because a number of people have called me, have praised me, and then also said that I'm sleeping with the devil and I'm doing the work of the devil and all of this stuff. And I can assure you I'm not. I've been doing this. I literally spend about 80 hours a week on this. I don't get paid a penny. All of your donations go to A Voice for Choice Advocacy. None of it ends up in my pocket. I'm thankful that I have two businesses that I run and have made good investments over the years. But I don't take any money from Voice for Choice Advocacy. So just wanted to share that and know that, I'm not going to bring this up again, because I hate this. To me, we show ourselves, we prove ourselves by the work we're doing. And that's how it is. So I'm going to be quiet and I'm going to answer your questions now. So thank you. Okay. First question, are there any updates on SB 871? Okay, so SB 871 was the bill that would have required the COVID vaccine of all children in California if they were going to go to school. That bill was pulled by Senator Pan back in probably March, April, and it did not make it through the House of Origin. So it didn't make it through the Senate. That means SB 871 is dead for the year. That bill number. Could SB 871 be put into another bill? Yes, we've seen a few gotten amends, which means they take everything out of a bill and put it in. I don't think SB 871 will rectify itself this year. The governor has said that they are going to wait until the next school year, 2023 school year, to determine or to have that as a requirement. My guess is by the time we get to 2023, the governor will reassess, and my hope is that there will be no need for a COVID vaccine. But part of what they were waiting for was to get enough children vaccinated that they can, so it's very hard to mandate a vaccine when no one's vaccinated or a very small amount of the population is vaccinated. It is easier to mandate it when you've only got a little bit more that you need to get to in order to get everyone vaccinated. And so I don't know whether it will move forward, but 2023 is the first time that it would actually move forward, 2023 school year. Okay. Next question. Will SB 866 be heard tomorrow evening? So yes, the Assembly added a session, a floor session, tomorrow evening at 6 p.m. Usually they are in session on Mondays at 1:30 and on Thursdays at 9 o'clock. They added an extra session tomorrow evening at 6 p.m. to deal with the budget trailer bills. So the budget was passed, had to be passed by June 15th in order for the legislators to keep getting paid. So they passed a budget, but they hadn't fully agreed with the governor on all the different pieces of that budget. And so in order to get agreement and get a final budget, they have to pass what's called trailer bills. Those trailer bills have been being passed by the Assembly and the Senate at the same time, and they need to get them through before they go on vacation, which is July 1st, which is Friday. They'll go on vacation. And so I do not believe that SB 866 will be voted on tomorrow evening. I think they are just dealing with trailer bills. Could it be voted on Thursday? It could be voted on Thursday. I actually am not sure that it will be voted on Thursday. If I had to guess, my guess, I have no idea, but my guess would be not, because I think they want to go on vacation. They want to get out of there and they don't want to deal with that. Okay, next question. Please review the ramifications of AB 1797 immunization registry for unvaxxed school children with medical exemptions grandfathered. Would it be obvious to those with access to the registry that the child is unvaxxed because no vaccines would show in a record? Also, how can we lock kids' records, and do all school employees have access to it? This is very invasive controlling bill. Okay, so there's a number of questions there, so I'm going to answer them piece by piece. AB 1797 is a bill that would require all doctors or all vaccination providers to enter all vaccines into the our state immunization registry. That registry already exists. It has for many, many years, but prior to this bill going through, not all doctors put the information in there. Now, if you have a doctor that uses care, they have to put the information in, and they just tell you, I'm putting it into the system. They have to tell you they're putting it into the system, but there's nothing that you can do in order to stop them putting it into the system. So right now, if you don't want your information in the system, you'd have to find a doctor who is not part of the care system, who doesn't enter the information in there, and then your vaccine records would just be held at your physician. If this bill goes through, every doctor that gives, or every provider that gives a vaccine has to put it into the care system. What that does is it means it has a complete record of all vaccinations given in California, which doesn't happen right now. My fear, and what I see this bill as, is really as a vaccine passport, the first step of a vaccine passport, because they will now have all vaccinations in that, and they can look at who has the vaccines and create a green, red, vaccine passport. The issue here that this person asked about medical exemptions and vaccinations. So I had a wonderful conversation with someone this week who actually has worked on the inside of the vaccine immunization registry, no longer does so, but and so gave me some better understanding of how this database is used and what's in the database. So currently, the medical exemption database, the CARE ME database, and this is not what you're asking about because you said yours were grandfathered, but if you have a child with a medical exemption, which are very, very rare, in the CARE ME database, that's actually a separate database. It doesn't link up with the CARE database at this point. It's supposed to be the same system, but it's not. It's two separate databases. If you have a child that has a grandfathered exemption, so their medical exemption is just on file with the school, they would not be in that system. Well, I shouldn't say they wouldn't be in the CARE system. Their medical exemption wouldn't be there. What I asked this person was, okay, how does it work if I don't have any vaccines that I've been given in California, or my children don't? Would my children be in the database? Like, is there a record placeholder for them? And what she said was, yes, if they were born in California, because if they have a birth record here, then they were entered into the CARE system, even if no vaccinations show up. So I haven't pulled my kids' records because I just assumed my kids weren't in there because they haven't been given any vaccinations. But I'm now curious, and I'm going to go pull the information to see if my kids are in there with any information. But so your kids may or may not be in there, depending on, if you had a home birth, they probably aren't in there. If you had a hospital birth, they may be in there. Then the next question is, how do you, so if they are in there and they don't have any vaccinations, then yes, it would be obvious that they're in there. If they are not in there, then it's probably less obvious because they're not in that database. They're not in the system. Interestingly, for the COVID vaccine, they already did what this bill does, because the government would not replenish a vaccine provider's stash of COVID vaccines unless they had entered every single and accounted for every single vaccine in the CARE database. So they didn't actually need this bill for COVID because of the way the government was supplying the COVID vaccines. So they didn't need this. But for other vaccines, doctors buy them from Merck and from Pfizer and wherever else directly. So the other question on here is, how do you lock your kids' records? So this is, if you go to the CARE website, it says, this database is opt out. In federal language and in state language, if something is opt out, it really means that you should be able to get out and delete all of your information in that database. Unfortunately, government databases don't have to follow the Privacy Act. If you're in a consumer database and you tell somebody, I want to be deleted, then they have to delete all of your information. But that doesn't work. That's not the case for a government database. It's what we're requesting with our amendments for AB 1797, have not been accepted, but it's what we would like is to make this an opt-out database where your information gets fully deleted. Right now, all you can do is lock your records. By locking your records, you basically, when a school employee or not a physician and not CDPH, but if you're under WIC or if you're under a school or nursing home, if you have your records locked, it means that they can't, when they put your name in and your birth date, the records that don't get spat out. It just says this is locked. But your records are still in the database, and CDPH has access to them, the government has access to them, and your physician has access to them. So hopefully that answers that. It was a long-winded answer to that question, but hopefully that answers that question. Okay, with PAN out of office after this year and so much protest, which direction do you see SB 871 going once it's up to be reviewed again in 2023? So I think PAN being out of office is huge. I don't think any of the other legislators, although he sort of tried to create this legacy vaccine work group, when I look at the legislators in the vaccine work group, there are very few that I feel are as strong as PAN. Buffy Wicks is strong. Senator Wiener is, but I just don't see him moving more bills forward. I don't think he had a particularly fun time this go around. Akila Weber, maybe. But there are, those are the key ones, but I don't think any one of them is as gung-ho as Senator Pan on this issue. I think it depends on where COVID is in 2023. I personally think we're going to be beyond it, and hopefully they won't require it. But again, as I said, my feeling is if they've only got 10% of kids that need to get vaccinated, they'll get those 10% of kids with a vaccine mandate. If it goes through in 2023, though, there will be a personal belief exemption. They would need to introduce legislation next year in January and have that be passed like SB 871 in order for it to not have a personal belief exemption. And I just don't think that anyone's going to do that in 2023. I think CDPH may do it, but then there would be a personal belief exemption. Okay, next question. Will Senator Pan next year in July 2023 push again to force the COVID vaccine on school kids now that the FDA has approved them? Is Texas a viable alternative to CA if this happens? So let's, as the previous person said, Senator Pan is out of office as of November of this year. Thank goodness. He most likely, my guess is, will be moving to the lobbying side of things. He has to wait a year, but he's working with his organization called Protect Us that is lobbying in the Capitol for these bills. My guess is that's what he's going to be doing unless he gets hired by the CMA, for example. But again, he can't lobby for a year after he's left the legislature. As for viable alternatives and states, so I would steer well clear of any of the states that have required vaccine mandates. So those are 6 states currently that don't have a religious exemption. That's California, Mississippi, West Virginia, New York, Connecticut, and Maine. You don't want to go to those. As to what is a viable option, so you have to work out what you want for your family and what kind of life you want from your family. And that includes political climate, that includes regular climate, that includes whether you want to live in a big city or a rural area, whether you want land, whether you want one party to be predominant. So I personally, when I think about if I were to move out of California, which I'm not doing right now, but if I were to move out of California, I would personally look for a purple state. I would not want to move to Texas or Florida. I love what they're doing, but at the same time, from a vaccine perspective, at the same time, they're as red as California is blue. And I would personally not want to move to a state that is at extreme on one side or another. I'd want somewhere where there's sort of middle ground, or at least both sides having the conversation. So that's me personally. But I think, I would go through and look at, get rid of the 6 states and then draw up a list of states that you would even consider. If I said to you, move to Montana, would you move to Montana? They have 1 million people on a lot of land. So for some people, Montana is great. South Dakota is another one. Amazing governor, great state, but it is darn cold there a lot of the year. And there's not many people. So, you need to work out. For me, I grew up in cities. And so, for me, having a city with culture close by is really, really important. So I can't advise on where to go, but you need to look at what's important to you and your family. Okay, next question. What are the chances of the COVID vaccine getting into the childhood vaccine schedule? So I take a deep breath or a sigh, because realistically, it shouldn't get into the vaccine, the childhood schedule at this point. It shouldn't get there for another 10 years if that's where we go. Unfortunately, ACIP, the organization within the CDC that recommends things to the schedule, is completely bought and sold. And so do I think it could happen? Yes, I do think it could happen. But it being on the childhood schedule, I think the other reason why they would want it on the childhood schedule is because then it solidifies it becoming part of the National Vaccine Compensation Program. And so you can't sue the manufacturers. You can't sue the manufacturers right now because it's EUA, it's emergency use authorized, but they need it to be on the childhood schedule in order for it to have that liability, to have no liability. So I do think it will get there. It shouldn't, in my opinion, but that's my opinion doesn't count on those things. Okay, is there any sign of UC or Cal State relaxing the requirement to test twice per week for unvaccinated next school year? I have not seen any. I had somebody that was looking at summer school or going to summer school, and they actually pulled out because they didn't realize that was a requirement. I think we should move away from testing and masking and all of that, but UC and Cal State don't seem to be doing that. But I haven't heard anything either way. I have heard rumors that they are going to remove the religious exemption from the COVID vaccine and still require it. And that is one thing that I have heard rumors. It's not for sure, but that was a rumor probably a couple of months ago that I heard. Okay. Would SB 1479, which requires schools to continue COVID testing indefinitely, apply to private schools? What about charter schools that are mostly on an IEM umbrella of schools, including Ocean Grove Charter School? So just going through, SB 1479 is a school that doesn't require COVID testing. It requires a plan for COVID testing, and it requires the schools to follow the CDPH guidelines. So if CDPH were to say you need to COVID test, then it would require testing. That's something that has been drilled into us by when we meet with legislators, where it's like, we know it's not a COVID mandate, but it kind of is a COVID testing mandate, but it kind of is. It does not apply to private schools. It only applies to public schools. However, we have seen, especially in the Bay Area where I live, private schools seem to follow whatever private schools seem to follow whatever the private school, I'm going to get it right. Private schools seem to follow whatever the public schools do. And that is because something interesting happened in COVID. In COVID, the county public health officer had meetings once a week with public schools, and private schools were invited to them. And therefore, private schools were following what the county health officer said, even though they didn't have to. And that was something very different this time that they've never done before. But prior to this, private schools we're private schools. That's why we're private, because we can do whatever we want. So what about charter schools? Charter schools fall under under public schools. And so therefore they are, I would assume that they are covered by 1479. So next question, how are the vaccine mandates still happening when it is a known fact now that people who have been COVID vaxxed and boosted are still getting COVID and still transmitting it? This is a wonderful question. And I really don't know how it is still happening. It is insane to me. I mean, one of the most insane things was the fact that the US removed the requirement for testing, and we can all discuss whether testing works or not, but assuming that you believe in testing and in vaccines, they removed the requirement for testing to come into this country from abroad, but they didn't remove the requirement for vaccination. So you could be on a plane fully vaxxed and have COVID and spread it to the people in the plane, but you could be unvaccinated and not have COVID and not be able to get in if you're a foreigner. It makes no sense at all. I agree with you. I think there needs to be a bigger push. And it's something, during legislative sessions like this, where we have, 10 plus bills that we're meeting with legislators on. A Voice for Choice Advocacy just doesn't have the bandwidth to do it. We may look at it in July, but we definitely will look at it come September, is doing more of a public campaign that you just can't have these requirements, because everyone is getting and transmitting COVID, regardless of how vaccinated you are or when you got vaccinated. But I'll just finish on that one. I did see somewhere that somebody posted, now I don't remember who, because I read so much stuff, but somebody posted that you've got to get your fourth booster, because if you get your fourth booster, or the fourth shot, not the fourth booster, the fourth shot, if you do that, then you're less likely to get COVID right now. And so go ahead and get that vaccine, because there's stockpiles of them, I hear, that we need to get through. Anyway, if AB 2098, SB 1479 pass the final floor vote, what is next? What else can be done to stop it? So all of these bills we've been talking about, they're currently in the second house. So they start in one house. If they start with an AB, they started in the Assembly. If they start with an SB, they started in the Senate. They moved through those houses, and then they switched places, and the ABs are now going in through the Senate, and the SBs are now going through the Assembly. The most important thing is that you call both of your legislators, and you're calling your senators for the AB bills, and you're calling your Assembly members for the SB bills. And any of these bills, find out the month of July, they're on vacation, but many of them are in their district offices, in their local offices. And it's a great time to get meetings with them. And a meeting is much more effective than a phone call. And in doing that, you're building a relationship. So remember, you don't want to piss these people off because you want them to vote in your favor. You want them to work with you and to vote no. I actually heard of somebody who went to one of the legislators on SB 2098. It was his senator, and the senator actually held off his vote supposedly because of this one constituent that had gone to him and basically had the conversation with him. So it only takes one person, but I would highly recommend in July finding out what your assembly member and your senator are doing, what local district meetings they're having, town halls, whether they're, cleaning up rivers or the beach or whatever it is, and go meet with them and really try to develop a relationship. That's the really important thing, because you want them to be passionate about you, that they vote for what you believe in and not what they're being given money for or whatever else it is. So the next step, when these pass, so most of these all of them by the end of this week will have gone through all the policy committees. The next step for most of them, I think for all of the rest of the bills, it wasn't the case for 866, but the step for all the rest of them is that they go to the Appropriations Committee. The Appropriations Committee hears them the second week of August, and then they go to the floor vote. So that's where every single person's assembly member and senator votes on it. If they have been amended, which all of these bills have been amended thus far, they then, if they pass the floor vote, they then go back to the House of Origin and they get voted on there. Trying to stop something back in the House of Origin, it's called concurrence, is pretty much impossible. Like, it just doesn't happen unless it got so egregiously amended. But if it got so egregiously amended, then the floor of the other side wouldn't have passed it. And once it gets past the concurrence, it then goes to the governor's desk. And all these bills have to be on the governor's desk by September 1st. And he then has a month to either sign or veto them. If he signs them, they go into law. If he vetoes them, they get thrown back to the legislature. If the legislature wants to bring them up, they have to pass them by a 2/3 vote. If he does not sign them, which rarely happens, but if he does nothing with them, they still become law. So hopefully that answered that question. Okay, next question. Why is California pushing so hard on all these COVID-related measures? Other states don't seem to be. Because we live in wonderful California. Our Democrats here, number one, we have a super Democrat majority, and many of the Democrat legislators in California are progressive liberals. So they are extreme liberals, and they feel strongly that these COVID-related measures should move forward. Now, go read about the World Economic Forum and what they are pushing on a global level, and then understand that many of our legislators believe in that. They believe in vaccine passports. They want, somebody called it, it's not communism, it's not socialism, it was something, not totalitarianism, it was something beyond that. It's special type of California, all of that, where they truly control the people. California is all about big government. They feel that they can govern your life much better than you can. They can raise your kids much better than you can. They can truly be the people that lead your lives. Unfortunately, when you look at California, it's hard pressed to see that they're doing the right thing when we pay the highest taxes and we have the worst roads and the worst healthcare and the worst schools and the highest homelessness and the highest crime of most other states. But that's the reason. It's our Democrats here. Okay, we have Proposition 65 here in California. Can we argue that vaccine ingredients fall under Proposition 65 and are harmful, especially to children? Great question. So Proposition 65 basically is a list of ingredients that are cancer-causing. And it's when you go into a restaurant, for example, they have signs up, or when you go into places that have been painted, they have signs up saying, you may die basically in here because there are cancer-causing materials or things that you may ingest. Unfortunately, it's interesting on this one. We have looked into this in 2015. We did a huge amount of research on this and trying to see whether the ingredients in vaccines count under Prop 65. So there are no ingredients that are under Prop 65 that sort of intersect with the vaccine ingredients. The only one that's in there is glyphosate. But the levels of glyphosate, the way Prop 65 is written about glyphosate doesn't equate to vaccines. We would love it. We've looked into it, and it just doesn't equate at this point. What approach to advocacy is most effective? Calling legislators, writing letters, writing emails, posting on the legislative portals, tweets, posts on Facebook. So it's a great question. I would say all of those are important. Okay, but when it comes to the primary importance, and I'm talking state legislature or local. So when I say local, it's school boards, it's board of supervisors. So those are the ones that we deal with and that we feel are most important to California, because those are the people that are making the decisions for you. Meeting in person is the most effective, building a relationship, even if you don't get along with the person. I had a legislator, our senator here in the San Francisco Bay Area, Jerry Hill. He left office 2 years ago. He and I had, and I still call him for mentoring. He did not agree with me on the vaccine issue at all, but we were able to have a really good discussions, and really we respected each other and we respected each other's opinion. And I would say if you can have a relationship like that with your legislator, it is so helpful, because you never know what piece of legislation that once you've built that relationship, what piece of legislation may come up where you can actually sway them, or you can get them to ask for an amendment, or you can get them to take a step back. So that, your goal should be having those relationships and building those relationships with your legislators. When it comes to, sort of one-off advocacy, I think the most effective is, I'll tell you what the least effective is. The least effective is writing petitions, writing rote letters. So, when we put up, we don't do it very often, but we sometimes put up letters where you can fill in your information and you can automatically send a letter to your legislature. If you do that, you'll see when we put it in, we put, make up your own letter. We give you the talking points, but we ask you to write the letter, because if it's the 100th letter they get, they treat all of those letters that have the same words as the same person, basically our organization sending it. So it means nothing. Sending individualized letters and handwritten letters also are I would highly recommend that, or cards, because there's something different. The other thing is that when in any of this, the key here is finding something that you find common ground with. So find something that your legislator, that you can say thank you for your legislator for passing certain legislation. Most legislators have some form of legislation that is good legislation, and to thank them on that, or to go help them on a beach walk, or if they're up for election and you do feel that they should be elected, you have to do it if you feel they should be elected, go help them with their canvassing, that type of thing. But it's really building that legislation. Making phone calls, you're a number, and that helps, because you want to have the numbers in their office that 50 constituents, really important to be a constituent, or to say I have a business in your district, or I have my child goes to school in your district, so that they know that you're part of their district, you're not just a random person calling. But the calling, you're a number and you're a statistic on, we had 100 people call against this bill or support this bill. That is important. Same thing with writing just generic emails, but that's important. The other place that I would say is important is when a bill comes to a committee, is uploading your opposition or support in the legislative portal. So that's if you go to any of the committee hearing, the committee websites, it has a little thing that says submit your position letter. That's important, because then you get counted in the committee hearing. It'll say, all these organizations, and then, 1,000 individuals, or it may say, sometimes they say many individuals, but usually there's a number of individuals. So hopefully that helps. For tweets and social media, if you want your legislature to be, called out, or you want to show them something, by all means, put them on your tweets or your Instagram or whatever it is. The one thing I would be careful with is, again, you want them to vote with you. If you piss them off, or if you, make fun of them, or, do something that annoys them, you're much less likely to get their vote. Now, is there a time and place for it? 100%. There are times when we're just so exasperated with the legislator, and you know that nothing you're going to do is going to change their mind, then you may want to, show how, what hypocrisy they have, or, something like that, then yes. But just make sure you're doing it consciously and you're not just, making fun of them or posting. And you never want to be rude or unprofessional in the sense of, really attacking them, because you don't want that. It reflects on all of the movement, and you don't want them to be able to say, oh, those crazy anti-vaxxers, look at this post, look at this crazy person, they're all crazy, because it doesn't help us in the long run. Okay, next question. My son is entering 6th grade now with a medical exemption, so we are 1 year from the 7th grade checkpoint. What are the minimum vaccination requirements for entering 7th grade next year so that we can start planning? So I'm going to pull this up because I have the list of them. I believe there are 13 shots. So for 7th grade, I'll go through kindergarten, I'll go through 7th grade because they're slightly different. So for both kindergarten and 7th grade, you have to have 3 doses of the DTaP, DTP, or Tdap. If you're in 7th grade, one of those has to be directly before 7th grade. Polio, you need 3 doses. Measles, mumps, rubella, MMR, you need 2 doses. And varicella, chickenpox, you need 2 doses. The hepatitis B vaccine, you need 3 doses for kindergarten. You do not need the hepatitis B vaccine for 7th grade. Specifically says you don't need it. But if you go into 8th grade, you then need it. So you will be required to get 3 hepatitis B vaccines if your school checks again at 8th grade. Some of them don't, but many, especially if you're in public school, they will check again at 8th grade. Okay, next question. Please offer your opinion of our best bet purple state to move to, considering medical freedom in all its aspects, including vaccine exemptions, privacy, and now abortion access. So I'm not going to get into the abortion access, and I really strongly feel that you need to do this research yourself. I mean, I could say, Arizona, North Carolina, trying to think what other, really purple states there are, in Illinois, Ohio, Iowa. I'm going for the ones that are the big states when you go into presidential elections where they're vying for each other, or vying against each other. But the real key piece is, like, I know I would never live in Arizona, right? So, me saying Arizona to you or to somebody, it doesn't hold the water. Like, I really would go through and look at the states, take the 6 states out that don't have any vaccine exemptions. I would get rid of all of the Northeast, which is all blue. I would get rid of the West Coast, which is all blue. I would get rid of Texas and Florida, although, people will argue, but I'm going with purple states here. I'd get rid of Texas and Florida. And then I would look at the states you're left with. And I can guarantee you probably half of the states you're left with, and if abortion access is important to you, then I would look at, take out all the states that have gotten rid of abortion, which gets rid of another, 20 states or so, and look at what you're left with. And I'm pretty sure out of those states, probably half of them, you'd go, yeah, I would never consider living there. Or, one of the things, I love going on road trips with my kids, and we go through many states, and I would recommend going on a road trip. Go on a road trip. I mean, I've had 2 really good friends of mine that have gone from California to the East Coast and back again through different states for the pure purpose of working out what state they want to live in and where they feel comfortable, and what, the people and different cities. If you want to live by a big city, or if you want to live in farmland, what does that rural land looks like? Are there a lot of meth heads in the farm, in the rural areas? You need to work it out. So, I would take the states and look at them and go visit them and work out, and really go visit them and see, what are the people like? What would schooling be like? What schools would you go to? Would you go to a public school? Would you go to a private school? Do you want to live in an inner city, in a rural suburban area, that type of thing? We know about Pan and Wiener. How dangerous are some of the lesser known legislators, such as Evan Lowe and Cecilia Aguirre Curry, for example? So I think those legislators have a certain amount of power, and they want to. Cecilia Abigail Curry is, she doesn't go this year, but in 2 years' time, she'll be done. Evan Lowe has a few more years, although he's in a contested seat this year because of the redistricting. I do think they have some, but I'm not sure without Senator Penn sort of pushing them on. The CMA, the California Medical Association, definitely has oomph behind it and money. And so if they want the money, then that's something to look for, that they will bring bills forward. But I just don't think they have the same power in the legislature as Senator Pan and Weiner. I don't think they want to take the heat as much. They're not willing to take the heat as much. If the immunization registry happens, how will that affect us if we move out of state? What will other states check that registry? So currently, each state has their immunization registry, but none of them speak to each other. There is a federal attempt to get them to speak to each other, but the California registry doesn't currently speak to any other registry. So you're okay for now. Now, if you look at the plans of the elite and the World Economic Forum, they would like all of us to be all in the same registry, all of our information to be in the same database so that they can, track us, follow us, do what China basically has done. But right now, for example, if you get vaccinated in Utah, your information wouldn't be in the California registry and vice versa. Okay, I'm a bit confused on how the legislature is educated on the bills that are put in front of them. I'm baffled how or why they vote as they do, especially regarding vaccines and the right to individuals, especially living in a free country. Why are they voting against rights of individuals and forcing them to be injected with vaccines that they do or can have negative health consequences? Why are they not leaving this up to the individual, knowing that there can be health consequences? So this is a great question. And this is probably the thing that frustrated me the most and still frustrates me the most about our legislature. So let me put one thing out there. I think in the next few months, it's going to be really interesting with the fall of Roe v. Wade, because here in California, they're saying, we need bodily autonomy, my body, my choice. And it's kind of like, okay, yep, we were saying that too a year ago on the vaccine issue. They are saying, mass surveillance, take off your period tracking app. We don't want the surveillance of people watching us and people following us and following whether we're going to California to get an abortion. Like, we don't want any of that surveillance. And it's like, yeah, we were saying that a year ago too on the COVID issue. So I think it's going to be really interesting to see how this all falls out. And I actually think the fall of Roe v. Wade may help our health freedom movement with privacy and with not having as many mandates. Your question of how the legislature is educated, if there is one thing I could change in the legislature, it would be to not allow as many bills in front of them. So every legislator can bring forward, every senator and assembly member can bring forward 30 to 40 bills each year. That means there are about 3,000 bills, so 3,000 pieces of legislation, changes to the statute that they want to make every single year that come in front of these legislators. Okay, there is no way on earth that a legislator reads all of these bills or understands all of these bills. Their priority is their bills, so they're 30 to 40. They know them well, although there are some legislators that I have talked to that have no idea what their own bill does, which is fascinating. The second priority is if they are if they're on a committee, if that bill comes in front of them. But even then, the staffers are the people who know the bills inside and out. And their staffers, they have a staffer for most committees. So they'll have a health staffer, an education staffer, a judiciary staffer. Some of them overlap, a business and profession staffer, a natural resources staffer, blah, blah, blah. And those staffers are the ones that have a big binder on the bill, know what the bill says, know the opposition points, know the support points, are the ones that are briefed by the committee. So the committee before every hearing says, this is the bill that's coming up. This is the issue. These are the people in support. These are the people in opposition. These are the amendments we're recommending, all of that stuff. But it's the staffer. It is not the legislator that gets that briefing. And then that staffer takes the bill to the legislature and says, here's the bill. And that's not just that bill. It's 15 other bills that they're hearing that day, or like tomorrow in one committee, there's, I think, 26 bills that are being heard. So they're going through every single bill. I can guarantee you they're not giving them a solid piece of information on the bill. Now, they may say, you know, this question got brought up. We think this is a really important issue, part of the issue. You need to be on target to be in the committee and ask that question, you know, or ask something about that. But for example, we saw, you know, when I was watching the 2098, the physicians misinformation bill on Monday, that hearing, you know, I wasn't there in person. I was listening to it and I was watching it. And it was just incredibly frustrating because everyone, the committee members, the author of the bill, were saying that the medical board requested that bill. The medical board didn't request it. The medical board is actually only supporting it if it's amended. Otherwise, they're not supporting the bill. The California Medical Association is the sponsor of the bill. And the fact that like the legislatures didn't understand that was, you know, it's a fundamental piece of that piece of legislation. They should not have voted it through because it's affecting the medical board, and the medical board's the one that's not supporting it. So basically, you know, it is because of the amount of legislation. It's because of the time frame. So our legislatures are in session 9 months of every single year. That is unheard of in most other states. Texas has a legislative session of 3 months every other year. Montana is six weeks every other year. You know, most legislative sessions are either much shorter, once a year, or every other year. When you have a legislature that is in session 9 months of the year, that's their job. And they don't have the time for it either because they're, you know, seeing so many bills in front of them. So they don't get educated on these bills. And I remember, you know, when it first dawned on me was during 2015 with SB 277. And we went, there was I don't remember, I think it was the floor vote. And we were going office after office after office. And we had a meeting, and the meeting was the last meeting we had of the day at 5 o'clock. And we said to the staffer, we said, you know, do you know how your legislature is going to vote tomorrow? And the staffer was just like, oh, no, we haven't briefed him yet. And I was like, what do you mean you haven't briefed him? And she said, well, we don't know where he stands on the bill because we haven't had that conversation with him yet. And I was just like, you are making these decisions about my child and whether they can go to school if they're not vaccinated. And you haven't, the legislature hasn't even looked at this piece of legislation. And it is 5 o'clock the night before a 9 o'clock hearing. And that was when I realized, you know, this is not, it's not a democratic process. It's not how it's not how it should be, but it is the way it is. Okay. Many groups have call to actions to contact committee members. Staffers ask for zip codes and sometimes say, you're not a constituent. If a bill affects all of California, shouldn't we be permitted to voice our opinion to committee members on bills? I called and asked my assembly member about this, but not surprisingly, Assembly Member Mays has not returned my call. So this is a piece that, again, it's really frustrating for me because I completely agree with you. So in a committee, right, the committee hears, say it's the education committee. The education committee hears a bill. Those legislators on that committee, their number one is their constituents, but their number two should be anybody who calls them with issues for that committee. Unfortunately, many of them don't see it that way and really feel that their constituents are the only ones. And so then it becomes, well, the question I would ask if they say that is, so who should I call to affect this committee? Because my legislature is not on this committee, and see what they say. But realistically, they should, you know, listen to you and hear you from the perspective of the committee. The other place that you can call is the committee, or you can email the committee staffers for that committee. And the key thing there is also putting your opposition or support onto the legislative portal. So that gets you counted in the committee. But realistically, I agree with you. They should, if they're on a committee, they should be listening to everyone that is concerned about the bill in front of them in that committee. But unfortunately, especially the Democrat legislators just don't feel that way. We can't move to another state due to family situation. Will moving to more or less conservative county here in California help avoid these mandates and other madness? How much power do counties have in these matters? So from a K through 12 school vaccination requirement, it does nothing, because that is statewide private public school. You would have to vaccinate or homeschool. From everything else, absolutely, it does make a difference. So your local county health director is the person that during COVID had the greatest jurisdiction over your county. We saw places like Placerville, El Dorado County, where they had very, very few COVID restrictions. There weren't mask mandates. There weren't, you could go to Placerville. I mean, we went up to Tahoe a few times, and you could go in there, and there were, you didn't have to wear a mask inside. You didn't have to do anything. You look at somewhere like Alameda, had mask mandates the whole time, had vaccination requirements. San Francisco had vaccination requirements. LA had vaccination requirements. Those were put in place by the county health officer. So absolutely, if you want to get out of those areas, go to the redder areas of California. It's surprising, but California definitely has blue areas in the urban areas. But once you get out of the urban areas, it gets there's a lot of red or purple areas. With groups such as yours, is it just that we do not have enough influence to get the legislators to change their view based on real factual information? Is it these guys choose one side of the research or science to make their decision for this legislation? Is it all money driven? Great question. It's a bit of all the above. So we don't have the money and the influence that, for example, the California Medical Association does, or the Teachers Association, or the prison guards, or the oil and gas industry, or Google, or Uber. It does come, their clout and power comes from money, but doesn't come from money necessarily giving to the legislators sitting in office. It's for their elections. So when you look at the bills that were pulled, you look at the employee vaccination mandate, the kids vaccination mandate, the bill that would have required sheriffs become law enforcement on public health measures. When you look at all of those bills and you look at who the opposition was minority, the health rights movement, minority, us. It was majority unions, agricultural organizations, sheriffs, law enforcement, schools, school boards, those types of organizations. Those are all organizations that endorse candidates and endorse Democrat candidates. And so they need them in order to win an election. One of the key differences this year from the other 2 years where we've had major battles is that this year is an election year, so it makes more of a difference. But then you take organizations like the CMA, the CTA, the prison guards, they have a lot of influence because of the amount of money they have in it and the amount of money they spend on lobbying. So the CMA, for example, spends about $8 to $10 million on lobbying every single year. They also have relationships. So, the French Laundry, Gavin Newsom was having dinner with 2 CMA lobbyists there. We don't get dinners at the French Laundry with Gavin Newsom, right? So it is the clout. The other piece of it, when it comes to research and science, we've seen it. We've seen mainstream doctors who questioned one thing about COVID and have been said, oh, you're an anti-vaxxer, you're a COVID denier, you're a COVID minimizer was the latest one that Penn called somebody. And they lose positions. They lose their, they get told you're no longer coming back as a professor. You're no longer doing, you can't be in part of our practice, that type of thing. So if a legislature takes our side and it takes our science, they are very likely to be denied or be called names, and they're not going to win their election on that. So therefore, their easiest default is to say, I go with what the CDC or the FDA says, or ACIP or CDPH. Like, I'm good with going with what they say, because if they say it, they must have done the research. And they don't want to be pointed out for being crazy. or for, having crazy ideas, and the other piece is, with the whole COVID thing, was anybody who questioned COVID or questioned the vaccines was suddenly a Trumper, and, they don't want to be that either. And so, I think that probably the biggest part of it is the extremes and the division that there is and that has been created in our country. Okay, has there been any formal request made to the Cal State University Board to drop the mandatory testing for unvaccinated kids approved for the religious exemption, since viral loads between vaccinated and unvaccinated are the same? I kind of answered that question. I don't believe there has been any formal request. The key thing, if you have a kid at any of these schools where they're requiring testing, you really, and unfortunately it's a minority, but you really need the kids to stand up, or the parents to stand up, and to come together in an organized fashion, because we've Voice for Choice Advocacy has written many letters to universities and that type of thing, and unfortunately even if we had 10 other organizations sending the same letter or similar letters, that's not what happens. It's the school environment, the people at the school want this. So you have to get them to not want it or to change it. And you need to do that within the community rather than outside it. Don't get me wrong, we're happy to help. We're happy to write letters, but it's not what, I've been to the University of California board meetings many times and spoken and given public comment, but it is not as powerful as the kids standing up and saying something. Does anything happen during legislators' vacation? They go on vacation. No, they usually take maybe a week or 2 weeks of actual vacation, but the rest of the time they're usually in their district office and they have meetings and they have events. So that's why I say go work out what events they have. 866 follow-up. If not heard tomorrow or Thursday, it can still be heard after the legislature vacation. Absolutely. So it has until August 31st to be heard. It has to be heard on the assembly floor, so it has to be during an assembly floor session, but it can be heard anytime up until August 31st. It has to be on the governor's desk by midnight, August 31st. So it has to have gone through both houses. Doesn't usually go through both houses on the same day, but we have seen that happen when rules get waived. Is there any possible way for SB 277 to be overturned? Ever? Yes. Short term, I just don't think so. What we have been trying to get is a religious exemption added back in. And there are, unfortunately, the two legislators, one in particular that was willing to carry that bill, left the legislature. So we don't have anyone that's willing to carry that bill. And it needs to be a Democrat. We have Republicans that would, but a Republican bill isn't going to move forward. So I do think there could be a lawsuit, and we're looking at lawsuits on it, but we've had 4 lawsuits in California that didn't go anywhere, and that are used as precedents in anything that comes in the future. So I think it will be hard to do to overturn it. Your question of ever, I do think ever is a possibility, but not in the next few years. How do you find out if you are in care? So if you go to, if you search California Immunization Registry, I don't remember, it's like careweb.org or webcare.org or something like that. But if you search California Immunization Registry, it'll come up. If you go on to care, somewhere in there, it says that you get to, it asks you if you want to, download your information. You do have to upload a document showing that you are who you are. So for example, to have a copy of your driver's license, which is part of why I didn't do it for my kids, because I didn't really want them to have, I know I'm in the DMV records, I know I have that, but I don't really want more information in the care database than need to have. But you can do it, and there is a way to search it. If the care bill passes, will it be retroactive, such as doctors would need to update vaccine status prior to the bill having passed? No, it would not. It would just be moving forward. If locking immunizations records does not delete them and the government can still access, is it worth to lock the records? Does that make you more suspicious to lock the records and add you to a list of people to target? I don't think so. I think many people do it for privacy reasons, just as you would lock your credit score or something like that. Possibly, but I don't think so. Is it even legal to mandate EUA vaccines to children? It is not, and that's part of the, they would like to say it is. It is legal, but it is not, and that's part of the reason why Governor Newsom said when he put the requirement into place, he said it would only go into a place once it had been fully FDA approved for the different age groups. Can you please give an update on AB 1993? Is it still on hold? What is the outlook? So AB 1993 was the bill that would have required all employees to get vaccinated in California, employees or contractors to get vaccinated in California. It died. It was pulled at first, but it did die. I don't think this one will come back. I don't think it will come back because, again, if you look at the opposition on that bill, it was all the Growers Association. So the Growers Association includes wheat growers and blueberry growers and almond growers, and basically the whole of the agricultural industry opposed that bill, as well as unions, as well as teacher organizations, as well as schools, as well. I mean, there law enforcement. There were so many people that opposed that bill that it would have it would be so detrimental to the Democrat Party if it was passed or if it came back. So I don't see that one coming back in the form that it was. I also don't see it being, with the lawsuits on the federal level, the states could implement it, but I just don't see that one coming back. I think that, to me, that was one that was a really long shot when it was introduced. Okay, can unvaxxed UC Cal State students be admitted into these schools if they agree to just test twice a week, or do they need a religious exemption as well as having to do the testing as well? I believe they had to, and this is just for the COVID vaccine, they had to submit a religious exemption as well as do the testing. I don't believe the option was vaccinate or test. I'm pretty sure you had to vaccinate, but you could give a religious exemption. If medical exemptions allowed for children, specifically kids on the spectrum, for any vaccine, including COVID, does the autistic child need an IEP, or will just the diagnosis count? You have, in order to not vaccinate your child and have them be able to go to public school, this doesn't count for most private schools because private schools don't have to honor an IEP. They have to have an IEP. They cannot have a 504, which is different special needs exemption, or a special needs program gives different services, but they do have to have an IEP to be exempt from the vaccine or not be required to get vaccines for K through 12. Also, have you heard anything coming down the pipeline for the monkeypox vaccine? So the last I heard was there are they've run out of supplies in New York. I don't think the monkeypox vaccine is going to take off. I think they're pushing it. My guess is, there's some old vaccines that need to be used up in the stockpile. Clearly, they've used the stockpile up. And this is, I say that tongue in cheek, but at the same time, go look at when they're pushing vaccines, go look at what the stockpile was and what the expiration date is on the vaccines. I'm pretty sure there's some correlation to it. I have no proof of that, but I'm pretty sure. Okay, some private schools require the COVID vaccine. Are private schools required to accept a personal exemption? So this is an interesting question. So private schools can do whatever they want. They can have whatever policy they want, but they have to follow law. And law says that they can only require these vaccines, or that these vaccines are required. And so they should be required to accept a personal belief exemption. Now, some schools will require and have a religious exemption. And, it's hard to argue to say, well, I want a personal belief exemption when they're offering a religious exemption, but they should allow some form of exemption other than a medical exemption. If you have a school that is requiring that, send me an email, because we have a letter that we were sending out, and most schools added an exemption. There was, I think, 2 schools that were boarding schools that for their boarding school students, they did not allow an exemption, a religious exemption or a medical exemption. And their offer was, well, then have your child come to the day school. They can come to the day school without the requirement. Are public online schools exempt from vaccine mandates, or do they follow the same rules as in-person public schools? So it depends on how you are classified. A public online school, if you have your own private school affidavit, so if you are a homeschooler and you're using online school as your school modality, then you are exempt. If you are attending a public online school, so it's a public school and they have online school, then it's a gray area. Because you're not coming in person. The law says that you would not be exempt, but some online schools, because you're never on site, will allow no vaccine mandate, no vaccine requirement. So it really depends on the school, and you have to ask them. Any reliable data on COVID cases, hospitalization, and deaths for COVID vaxxed versus COVID non-vaxxed? Is this even being tracked? So it was being tracked until they realized the vaccinated were getting COVID. And then the CDC, I don't remember whether it was April or May, stopped, or maybe even before that, maybe March, they stopped tracking vaccine status as part of that. So you can find it on some individual levels, like county levels. Sometimes they track it. Different hospitals may track it. But for the most part, that data, it's certainly not available on a federal level. It was for a while there. But once the numbers started going in the wrong direction, they stopped it. The CDC stopped following it. Will you address vaccine health passports in a post Roe v. Wade world? So I don't know where it's going. I think, the larger, if you look at the World Health or the World Economic Forum, they would love everyone to be tracked, using chips and wanting everyone to sort of pay with their chip on their hand and that kind of thing. It's transhumanism. It's, if you look at, and there's a wonderful guy not a wonderful guy, he's certainly not wonderful, but a wonderful presentation by this guy from the World Economic Forum that sums up, that humans are hackable, and that the next generation of humans, we came from chimpanzees to humans, and the next version is going to be a hacked human, an AI human, a cyborg type person. So when you look at that, it's interesting to me, the post Roe v. Wade, because there's a huge, I've been reading 5 to 10 articles in the past week about mass surveillance and, period trackers and trackers that, come from you're moving to different states, or you're going to a different state to get an abortion. Because some of these states are saying, if you went to California to get an abortion, you're still, illegal here in our state. And I don't know whether they're going to fine people or what. So I think it's going to be interesting to watch, because there's definitely a butting of heads that's going to come, where they realize that, we're asking for this, but we're not giving on other things. I think it's interesting, there was an amendment to the Constitution that's going into our November ballot here in California that sort of solidifies reproductive rights. I would have loved them to not use reproductive rights in that, or reproductive freedoms, I think is the word. I would have loved them to use bodily autonomy, right? I think everybody should be, it shouldn't just be women that have reproductive rights that are from the perspective of abortion. I think we should all have bodily autonomy, and that would have been a great constitutional amendment. But unfortunately, that's not what they decided to do. Do you have a list of colleges that do not require injections in California? I probably do, but a not updated one. What I would recommend is look at the schools that you want. Most of them don't require the COVID vaccine, especially if they're private. I would look at the schools that you're thinking about. Again, it's kind of the same way as the states. Rather than look at everything, narrow down the ones that you want, and then look at them and see whether they require it. The majority of them require at least like the children's vaccination, so MMR, hepatitis, Tdap, those types of things. But some of them still have religious exemptions. Many of them do. Do immigrants to CA get injections at the border? I don't believe so. No. Is it worth calling my representatives to voice my opinion when my representatives are Buffy Wicks and Nancy Skinner? I do, but just seems futile and discouraging. I agree with you. They are probably the worst, and they're not going to change their minds, but I still think they need to hear from their constituents, that there are constituents that disagree with them. And because ultimately you're the people that vote for them. And if they hear enough outrage in their district, will they change? Will they question? Will they, will something in them give? So yes, I would do it. I wouldn't spend a lot of time and effort on them. Okay, I feel that my senator and assembly person, very, very liberal and vote Democrat line is a lost cause, and they will never vote no on these bad bills. I feel that it's a waste of time to meet with them and continue to try and communicate with them. Am I misguided? So kind of along the same thread theme there. I would at least voice your concern to them, because if they don't hear any concern, then they think everybody agrees with them. Having said that, I wouldn't spend too much time, money, effort. Those are the things, whenever I have conversations with people on, where should you be spending your time, money, effort, those are the things to think about. So you don't want to spend a lot on your legislators if they're really, Buffy Wicks and Nancy Skinner. Where I would put your efforts in that case is to your community. We have to have a tipping point, right? Again, if these people start voting against these people and don't vote them in, unfortunately, Buffy Wicks is running unopposed. I mean, I don't know how that happens, but but she is. So is Mia Bonta. Two of them that I'm just like, how do they not have anyone running against them? Even if it's somebody that means nothing, but they should at least have some competition here. But if your reps are that bad, number one, I would also focus on school boards and board of supervisors and see who they are. And then I would also look at your community and who can you affect in your community? Who can you educate in your community? If you're living in that kind of community, it is probably hard. But there are people out there, and there are ways to get at them in that you don't have to be, don't take the vaccine. It's having the conversations. It's having the conversations about transmission. Oh, you got boosted. Yeah, you still got COVID. I got COVID too. Wasn't that bad, or it was bad. It was probably about as bad as you. Those types of conversations. One of the things that I say to people is, wow, you know what? Seems like the only people that really made money out of COVID are the pharmaceutical industry with their vaccines. I wonder why they're pushing a fifth one, a sixth one, kind of thing. Work out read the audience, but have those conversations, because that's where we're going to make a difference long term. Okay, how important is it that we show up to committee hearings? If we have a limited time, should we focus more on meetings with legislators ahead of the hearings? I feel it isn't important to show up, but in reality, not sure how much of an impact our presence has. So 100%, the committee hearings are dog and pony shows, okay? We need our best dog and pony show happening, and we need as many people calling in, but at the same time, where the decisions get made is prior to those hearings. It's why, a Voice for Choice Advocacy, in the last month, we've probably had over 100 meetings with legislative officers. And we only do that because that's where we make a difference. That's where our voice gets heard. It doesn't get heard in the committee. Most of the time, most of the committee members aren't even in the committee room listening. They're at some other meeting or doing something else. So it doesn't really make that much of a difference in the hearing. Most legislators walk into that hearing knowing how they're going to vote. There are every now and then, there are definitely bills that change on the Senate, on the floor, or in a hearing. But for the most part, that's not the case, especially on high profile bills like our bills. So absolutely, if you're going to spend, again, time, money, effort, if you're going to spend it somewhere, it's having meetings with your legislators and building those relationships. Okay. What are your thoughts on the READ ID government saying May 2023 is the deadline? Do we really need it? And does it have anything to do with the World Economic Forum? I think you mean the real ID. So real ID is basically your driver's license. You're not going to be able to, you're not going to be able to fly with a regular driver's license. You have to have a real ID. In order to get a real ID, you have to show your, I think it's 2 versions of that you live somewhere. If you don't have a real ID, you have to have a passport to fly within the US. If you have a passport, the government has the same information as what you have for a real ID. I think it is, do I like the real ID? No, I don't like the fact that you have to, prove more. But ultimately, it's one of those things that you have to make a choice of whether you are going to let anything be given to the government or not. And if not, you're living off the grid somewhere, because they're tracking that you're on this webinar. They're tracking your phone. They're tracking, they have the ability to track it. Whether they're actually reading what you do is another story. But I'm sure most of you have had the experience where you're searching for something online, or you said something in the car to one of your kids, and suddenly you've got ads showing up for that thing. You know, we live in a world where we are tracked and traced. Now, how much of it each individual person's tracking and tracing, like I'm pretty sure I have way more tracking and tracing on me than any of you do, or most of you do, I should say. I don't know who's on this fully, but the most of you do, because I'm outspoken and I've taken a stand on this issue. But I just assume that everything I write, everything I do, unless I use, a Proton Mail or our secure servers or, that type of thing, that the government has access to it. And I can't live in a paranoid place like that. I'm never going to go live on the grid, off the grid. It's just not going to happen. That's not who the person I am. And so I think you need to work out again, where do you sit? Where do you want to be? Do you want to live off the grid? Do you want to live in a community? Is America the right place for you to be living? Do you go to, move to some South American country or somewhere where you truly can live in a community off the grid? That's not for me, but it is for some people. Most legislators are not doctors. Isn't it illegal for them to mandate EUA vaccines? So they're not mandating them right now, but legislators can pass whatever legislation they want, and they are not liable for the legislation they pass. How can we limit CA legislators from receiving so many each year? What can we do about this solidly? I don't understand whether you're saying receiving money or receiving that they have so many bills. There is nothing we can do about the bills unless we were to do, for example, an initiative. I would love, if I were governor, I've come up with my list of things if I were governor. If I were governor, for every bill that is presented to me, I would ask for 2 bills that remove statute. I mean, if you think about it, we have probably out of those 3,000, about 1,200 or so are signed or come in front of the governor, and about, I think it's 800 to 1,000 actually get signed by the governor. If we have 800 pieces of legislation that change the statute every single year in California, just think of how many we've had just in the past 5 years, right? I mean, we've had over 4,000 different changes to our statute, and they're adding. They never subtract, they always add. And so, one of the things I would love to do is to say, okay, you bring one forward, you need to remove 2 things. There are crazy things in our statute still. There's one at the beginning of this, I went through to find crazy California laws. There's a law that you cannot eat oranges in your bathtub in California. You also can't wear a house coat while driving in California, and those are still laws from I don't know when. But so anyway, there isn't really anything we can do about it other than if we would have an initiative, a ballot initiative, to reduce the number of laws. Or if the legislature wanted to bring a bill forward, but I don't think any of them would do that. They don't want to limit their power. They're in there for the power. Do you think that good, honest doctors will be leaving California if this new law passes? I do. And they already have. So we saw it with the medical exemptions when they weren't able to write medical exemptions anymore and they were being witch hunted. I would say nearly every single doctor has left California or are planning to leave or have given up their practice here in California. So the answer is yes. And I think that will happen. I think we will, and we have a shortage of doctors here in California already. If you've excluded your kids' records from the Care 2 and the immunization registry bill passes, will the school be able to access the kids' records? No. If you've locked it, so you can't have excluded your kids' records unless you went to a doctor that didn't use the Care 2 system. The vaccines that they've gotten thus far wouldn't be in the care system, but going forward, they would be. I have been granted an extended stay for work by Homeland. I used to be able to come and go back and forth from Canada. Will the requirement for fully vaccination to enter, can you point me in an immigration lawyer that is pro-vaccine choice? Any advice appreciated. So if you have a visa, that doesn't count. If you have a green card or you're a citizen, it counts. If you just have a visa, you need to be vaccinated to come back in to the US. And as for a good immigration lawyer, I don't know any. If you need help, if anyone needs help with their green card and getting a religious exemption for their green card, that is something that I can help with. Okay. For the registry bill, if you already provided your school with your child's immunization record on paper, but for some reason the doctor's office didn't enter the vaccines into the state system, do you expect the child would be flagged? No, I think this is the new registry, or the new requirement to put the vaccines in the registry is going forward. I don't think they will be putting them in backwards. I think there may be some doctors that do, but the majority of doctors that would do that, I think, would also already have put them in the care system after they gave the vaccines. Why do you keep discouraging wearing masks? It's one thing to avoid vaccines with good reasons, but aside from little kids, there's plenty of good things about mask and COVID and flu too. So the mask debate is huge, and I'm not going to get into it this evening. Again, I think you have to do your research and you have to come to your own conclusions. I've done my research, and to me, the act of wearing a mask has a more detrimental effect on mental health, on your own health, because you're breathing in. If you're wearing a good mask that is actually going to stop you getting the virus, you have to be wearing a well-fitted N95 mask. Wearing a cloth mask does absolutely nothing. Even Fauci has said that. We've evolved, but we've come to the place where the only thing that's really going to stop you from getting COVID or anything else is if you're wearing a good fitted N95 mask. If you're wearing a good fitted N95 mask, you are not supposed to wear those all day. You're not supposed to wear those for long periods of time. You're also supposed to dispose of them after you've worn them and wear a new one every single time, because what you're breathing in, you have to understand, if it's not allowing stuff to come in, it's also not allowing the stuff to go out. And so you're breathing in whatever bacteria, our system, and this is my research and my perspective, so do your own research. That's what a Voice for Choice advocacy is all about. But my research is your body, the part of what our breathing process is to get bad stuff out and to breathe good, air in. Hopefully, some of our air is not great, but and so to me, wearing a mask is more detrimental to my health, and I'm weighing my risks and benefits. I also am not afraid of getting COVID. I'm not afraid of getting the flu. To me, disease is a muscle. Your immune system is a muscle. As your immune system gets tested, your immune system gets stronger. That's my perspective. I know there are people that believe in terrain theory, where none of these viruses even exist. And there are people that believe in masking and believing in not getting sick. You have to do your research and you have to do what's right for you. So if you feel wearing masks is what works for you and your family, and you've done your research, the most important thing is that you've done your research and you've looked at the risks and the benefits of anything, and you've made that decision for yourself. From my perspective, I've done the research, and I don't believe wearing masks makes you healthier. Right. Do the pharma lobbyists approach and try to create relationships with every single legislator in the state government? Do you think they actually write some of these bills? Yes and yes. I mean, they have. So the CMA lobbyists, there are, I think, probably 10 to 15 of them. And they absolutely have relationships with our lobbyists. We have two lobbyists. Our lobbyists have relationships with every legislator, most legislators. How good those relationships are depend on the legislature. Some of them they're very, very good. I would say even friends with. Others they are, they're more lobbyists. They're more on a professional level. But absolutely, yes, they have relationships with every single legislator, and good relationships, and they give money to them. And do they write some bills? Absolutely, 100%. They write them. I mean, we write bills too, but ours just don't get authored all the time. We wrote a bill in 2020 that did get authored by Assembly Member Christina Garcia that will, as of next year, label the ingredients of all feminine hygiene menstrual products. So absolutely, during November through February, we shop bills. So we take bills to legislatures and say, this is an idea we have. Will you author this bill? The CMA, the CTA, the prison guards, all of them have a much higher chance of getting their bills authored because of the clout that they have and the lobbyists they have. Okay, how effective do you think the Informed Consent Action Network, ICANN, has been at stopping vaccine passports and COVID shots from being added to the childhood vaccine schedule? I don't think any of us have that power, honestly. I think ACIP and the CDC and the FDA have that power, and if you look at who's behind them, the pharma industry has that power. But I'm a fan of ICANN and the work that Aaron Siri does. Their lawyer. I appreciate all of their work, but I don't think we really have that clout. My 12-year-old son is unvaccinated for the childhood and COVID vaccine. I was thinking about his future. Are most colleges requiring immunization records? Are there colleges that don't require these records? I am looking at having my vax kid in high school so he can attend college. Sounds like community college can do whatever. And I just looked at UC system and it looks like they're requiring these vaxes and lose their enrollment. He's currently on an IEP, which I'm assuming is only for K through 12. Yes, IEPs are only K through 12. My recommendation, if you're in California and you've got a kid going through school in California, get them the hell out of California. Excuse my language, but I would not have my child go to school in California, go to college in California or university in California. I would have them leave California. Most states have religious or personal belief exemptions that you don't have to be vaccinated for at the college level or at the K through 12 level. ICANN is in so many legal battles directly with the FDA and CDC. They're not in legal battles. What they do FOIA requests, Freedom of Information Act requests. So when a Voice for Choice Advocacy does a lot of these too in California, especially, we just don't publicize them as much because we get information. If there is information, we'll share it, but many times there isn't information. So what ICANN does is they request information. So under the Freedom of Information Act, you can request information, any information from any public entity, which the FDA and the CDC are. And so they write letters saying, can you show us that you have done the following research? Then the CDC and the FDA come back and say, we have no records that pertain to this issue. And that's interpreted as, no, we haven't done that research. And so that's what ICANN is mostly doing. They're not actually in any. They may be in one or two legal battles with the FDA and CDC, but most of what they're doing is Freedom of Information Act requests, which anyone can do. You can do them. You can ask for any piece of information. In California, they're called Public Records Act requests. We do a lot of them to just get insight into what's going on behind the scenes, because places like CDPH and the medical board have to reveal that. Do you think Newsom will mandate the vax in 2023 for teachers? For now, it's on hold. It's interesting because there are a lot of teachers that it's not on hold for. So he never said that, there's never been a mandate for teachers. He made it up. Schools required it. Schools put it on hold. Some schools have put it on hold for 2023. There are other schools that I know of, public schools, that have required it for their teachers, and there are private schools that have required it of their teachers. I don't know whether a Newsom will mandate it. It's a harder one because the Teachers Association is split on it. How do we get these groups to oppose bills like 866 and 2098? Don't those people have kids and care about the care they receive from their doctors? Yes. And we have reached out to all of the people that oppose the other bills, those organizations, and we've asked them to oppose these bills as well from that exact perspective. Unfortunately, they really don't want to get into the vaccine issue. It isn't an issue that they want to be seen as opposing. They have people that work for them that are for the vaccine issue. And so it is hard to get them to take a stand when it does not directly affect them. And when we send a letter to the organization, they don't disseminate that letter or that request to all of the people in their company. So it's, it becomes hard. Does the Cal State and UC schools accept religious exemptions for all the other vaccines beside COVID? No, they do not. They only accept a medical exemption. How can anybody have informed consent if the vaccine inserts are blank? So the vaccine inserts are blank, but I know this is a big thing that people have shown the vaccine inserts. So because they're emergency use authorized, they don't have to have a vaccine insert. What they have to have is an EUA summary, which is on the FDA website. And if you asked the person administering the vaccine, that's what they should point you to. There is a full EUA summary on the FDA website that has all the information that would be in the vaccine insert. What criteria are required to end the state of emergency in California and federally? And will the EUA concerns go away when the state of emergency ends? So this is an interesting one. So in California, the governor has to decide that the state of emergency is no longer a state of emergency. That's basically his criteria. The only other way is if both houses, so the Senate and the Assembly, state Senate and state Assembly, put forward a resolution to end the emergency. And if they do that and it gets voted through both houses, then the state of emergency would end. The Republicans tried to do that. The Democrats didn't go with it. And so basically it's up to Governor Newsom to decide when our state of emergency ends in California. As for federal, it's up to the president. And so the interesting thing is I've asked this question and I haven't gotten a full answer, but when the state of emergency ends, my understanding, but don't quote me on this, is that the emergency use authorized medications, vaccines, devices, tests, all of those are no longer authorized because it's only in the state of emergency that they're authorized. And so my understanding is that all of those go away. And I think that's part of the reason why we are still in a state of emergency, because I think they're waiting, my perspective would be they're waiting for the vaccines to be fully approved for all age groups. They're waiting for the tests, some of the tests to be fully approved. There's not a single test that has been fully approved, which is interesting to me, but they're waiting for some of the medications, the treatments to be fully approved. So it'll be interesting to see when they actually get rid of the state of emergency. Is independent study with the public school exempt from vaccination? Yes, they are. The Informed Consent Action Network is taking the CDC and FDA to court over the MMR vaccine and other vaccines, challenging them to prove without harm and the efficacy of the vaccines on the childhood vaccination schedule. So they may be doing that. From my perspective, most of what they send out in their emails are reactions to FOIA requests. So I'm sure they do have some legal suits. I think it's going to be hard. I'm curious to see. I would love them to win. Don't get me wrong. And I think, Aaron Siri, if there's somebody that can do it, it's Aaron Siri that can do it. But I think it will be hard to do. There's just a lot of money and a lot of government behind that. And unfortunately, our legal process in this country is not unbiased. We saw that in California. California has an incredibly biased legal system that is biased towards public health and towards the progressive liberal side. Okay, so to recap, this is in the order of what's important advocacy-wise. The relationship with your legislators, number 1. Submitting to the portal is number 2, and contact committee members via phone or letter is number 3. Yes, it's not worth time to contact legislators outside of my district on bills. It is not unless you have a relationship with that district. So for example, if you have a vacation home somewhere, you can call and you can say, you could probably say you're a constituent. If you, like in the Bay Area, I live in Santa Clara County and I have one set of legislators. I have a business that services San Francisco, so that's a separate set of legislators. I have a child that goes to school in the South San Francisco area, so that's a different set of legislators. Those 3 sets of legislators, I still go and meet with them in person, and I introduce myself as, I have a business in your district. I don't vote in their district, but I'm still important as a business person in their district. So, if you can find a reason that you're in that person's district, then fine, then absolutely go and contact them and build those relationships. But if you're, I would never call a legislator that's not on a committee. I would never, me personally, not a Voice for Choice Advocacy. Voice for Choice Advocacy, we contact every single legislator. We have meetings with all legislators. But me personally, I would never contact a Sacramento legislator to let them know my comments on a piece of legislation. Besides the Voice for Choice Advocacy, do you have other suggestions for groups to be a part of to stay informed or to advocate? So I'll tell you the groups that we work really closely with. We work very closely with CHCA, California Health Coalition Advocacy. They are also the only other 501c4 in California. So Voice for Choice Advocacy and CHCA are the only two groups that have lobbyists in California and that are 501c4s that all we do is legislation stuff. So those are two organizations from a legislative perspective. And then the other group that we do a lot of work with is Educate Advocate, and they are special needs or they're an organization that helps special needs children and parents of special needs children. So all of the IEP questions, they're the group that we go to. We do some work with Freedom Keepers. Again, beyond that, my recommendation, there are a lot of organizations out there. The other organization that we partner with on a national level, so if you want to look at what's going on nationally, is Stand for Health Freedom. And they are the one group that we partner with. We are their California group. So they have a group in every state, or nearly every state, that they work with, and we are their California organization. I'd look at what your priorities are. So our priority is legislation. We also, on our 501c3, we're working on, we haven't revealed this, but we're working on sort of getting toxins out of schools. So getting pesticides out of schools, getting disinfectants out of schools, that kind of thing. We haven't launched that project yet. We've been working behind the scenes on it diligently. But, I would look at what do you want the organization to be doing for you. If you want legal on a federal level or individual, great organization to follow from that perspective. Children's Health Defense is a national organization. They do have a California chapter, but they don't do legislation and lobbying. They do more education side of things. Bobby Kennedy wrote his book on Fauci, those types of things. So look at what jives with what you're interested in, and where again, I come back to time, money, and effort. Where do you want to spend your time, money, and effort? And what organizations jive with that? For some people, lobbying and legislation is the worst thing and they don't want to have anything to do with it. Great, then don't do that. go do something else. So I think that's, the way I look at it is look at what the organization does and look at how they spend their money, what they spend their money on, how much money they raise, and where that money goes. And if they're transparent about it, one of the big things with us is that, every penny that people donate to a Voice for Choice or a Voice for Choice Advocacy goes back into our organization. It pays for, Voice for Choice Advocacy, it pays for a lobbyist, it pays for our, the 4 people that we hired this year to help me so that we can do it. But it all goes back into that. And our, as I said, at the beginning of this, our records are public knowledge. Look at who is doing what you like, and I'm also going to say, who's actually doing the work, who's got their nose to the grindstone and is doing the work and is not doing it for ego purposes, because there's a difference between talking a lot and doing a lot. And I personally work with people who do a lot, and it doesn't mean to say we hit the headlines. we just get the work done. Can teachers be mandated to get the vaccine if AB 1993 doesn't pass? So yes, because like the LAUSD required all employees to get vaccinated. If you didn't get vaccinated, you could have a religious exemption, but you lost your position. The teachers were pushed into the hybrid, the online learning school, but many of them have lost their positions. So can they? Yes, they can. There's no law. It is the school district's policy, and they decided to do that. Heard anything about why COVID home tests have such quick expiration dates? Any data on how reliable these home tests are that are being pushed on us all the time? So I don't know about the expiration dates. I saw an article on that. Can you use your COVID home test that expired? I didn't even ever look that they had an expiration date on them. So I will go look the next time I have one. How reliable are they? I would say they are reliable, but not reliable. So if you are symptomatic with COVID and you take a test, I think they're pretty reliable. I still wouldn't count on them 100%. Okay. But if you take one after the other, if you take one in the morning and one in the evening and they're both showing, strong line COVID, I would say you likely have COVID. if you take them and you don't have symptoms and they show you have COVID, I think they're completely unreliable. They have a very, very high false positive rate. So, I think there are a lot of people that were being tested on a regular basis that got COVID, no symptoms. And maybe they have had COVID before, so their body was fighting COVID. I don't know. But in those cases, I don't think those people really had COVID. So, that's my perspective. Again, I would go do the research on the tests. I think there is a lot of false false positives on them. What good is informed consent when you still have to have the shots anyways? If I refuse the shot, you will be refused entry to school. Yes, I agree. The answer by the legislatures is, well, you don't have to go to school. You can homeschool, or you can, do online school. So you're not missing out on school. It's your choice not to get the vaccine. So you're not being forced to get the schools. But this whole situation is so bizarre, Christina. Is there any possibility that non-humans are trying to eliminate the human race through pandemics and vaccines? Is there a possibility? Yeah, of course there's a possibility. I have no idea. I'm just a human, but could there be cyborgs in our midst? There could be. I don't think there are. The only reason I say that I don't think there are, because I think the people who have the technology, such as Gates and Bezos and Musk and all of them, they're talking about it still happening. I don't think I think if it was happening, I think they would already be there. But they definitely see the future of it and are excited to be that future. I personally don't want any AI and cyborg in me, but that's where they, and I think there are a lot of people, especially here in Silicon Valley, that would be excited to have chips and bits put in them to make them the superior race. Okay. Is there any way to make our leaders recognize natural immunity? People who have had COVID antibodies should not be treated as unvaccinated. In fact, people at my job with recent infection and antibodies likely have more protection than somebody who has been vaccinated a year and a half ago. Although given the vaccines don't prevent infection or spread, the mandates are ridiculous anyway. So natural immunity is something that I have wondered why our country, and it's truly our country, because in Europe, at least you got sort of 3 months or 6 months or a year, set aside if you had COVID. You just had to have a positive test. You didn't have to have antibodies. But in America, we completely disregarded natural immunity, something that has never in history been done before. And I don't understand why. Now, I wouldn't count antibodies because I believe I have had COVID twice and I don't have any antibodies. I think it's I don't think we have a good understanding of our immune system when it comes to COVID. I think for things like pertussis, whooping cough, measles, those type of things, antibodies are shown. But I think there are some diseases that antibodies aren't the answer to having immunity. So I think T cell, some people do have antibodies, don't get me wrong, but it's interesting to see that there are many people that I know of that have had COVID, tested positive, had all the symptoms, down to it, and have not gotten antibodies. And people in the same family that has the same thing at the same time, some of them had antibodies, some of them didn't have antibodies. But the whole natural immunity thing I agree, has just blown me away that this country did not recognize it at all. And I don't know what there is to do about it, because it's sort of, it's where we're at. I'm seeing it coming in more though. I'm seeing there was, I think it was the NBA or the NCAA that actually said, if you've had COVID, and I think somewhere in Berkeley, somebody sent me something in Berkeley that said, vaccinated for COVID, natural immunity, or testing or something like that. So it's sneaking in there, but it's really not as prevalent as it should be. What do you think about the announcement that the World Economic Forum, that $300 billion worth of vaccines had to be dumped? I think it's probably true, but the people who won out on that were the pharmaceutical industry, because they got paid for them. The government lost out. I think they have expiration dates on them, and they have to be have a cold chain. And so I'm not surprised. Because most countries bought, 4 doses for their entire population, and we're only just seeing infants being vaccinated. So I'm not surprised, and I think it's a marketing tool too. But yeah. I know you're pretty much done, but any advice on how to stay sane and not completely depressed about all of this stuff? You seem quite resilient. Wonderful question to end with. You have to look on the bright side, and you have to focus on what's important to you. So to me, my family is really important. Being happy is really important, and not being negative is really important to me. And I'm going to say I don't sweat the small stuff. I do. If you ask my kids, they would know I do. Get sleep. The other thing is get sleep. We're in this is a marathon, not a sprint. Make sure you take care of yourself and work out what your life looks like. Ultimately, you're on this planet for you. You're not on this planet to be ruled by everyone else. And so you need to work out how you live your life happily and fulfilled. And whether that's, for some people that's religion and is included. For some people that's being out in nature. For some people it's being around their family. For some people it's all of these things. But work out what's important to you. That's how I live my life. I know what's important to me, and this fight that, doing lobbying and legislation is important to me. It's what I'm passionate about. I love it. I'm crazy to love it. I know that, but I love doing what I do. I love talking to legislators and trying to convince them otherwise. It's really, really hard from when we come. And there are many a day when I come home and I'm like, oh my God, that was exhausting. But know what's important and know how to take care of yourself. You have to take care of yourself first. You have to know how to stay healthy. And for everyone, that's different. For some people, that's running. For some people, that's, watching TV and getting your mind off things. For some people, that's meditating. But work out how you stay healthy in yourself and what's important to you and how you can be happy. You only live, in my opinion, you only live this life once. You may live different lives more times, but you only live this life once. And so make the most of it. And if this is too much for you, get out and go somewhere else. Go to Mexico, go to, I don't know, Europe, go somewhere else, go to some other state, go into the wilderness, go travel, do something, take your kids, uproot yourself. I know that's much easier said than done. I can't do that. But work out what it is that's going to make you happy, because we need to be happy in life. So those are my last pieces of advice, but thank you so much. And but thank you all for your support. The other people, you're the people that make me who I am. And it's when I receive emails saying thank you, Christina, or just helping people out of situations and hearing good news, and even hearing bad news, but just knowing that you're out there supporting me in our Voice for Choice advocacy. So other people ask, what can we do? So number one, what you can do is talk to your legislators. That would help. We need constituents talking to their legislators. But other than that, if you want to support a Voice for Choice advocacy, we are completely donation based. And I would say 99% of our donations come from small donors. So we work hard for the money we get. You can go and donate at a voiceforchoiceadvocacy.org/donate.